Hi, I'm Dr. Duffy again, and this is the third in a series of videos called Tips for Seeing a Psychiatrist. And this third video is on taking psychotropic medication for depression, anxiety, or ADHD. Because the brain is so complex, everything I say should be considered extremely oversimplified, and for that reason, not precisely accurate. For example, I talk like there's just one serotonin receptor when there are many. I act like serotonin, norepinephrine, and dopamine are the only neurotransmitters. There are 40 plus neurotransmitters, in fact. I act like neurotransmitter problems are the only explanation for mental problems. The gut, the biome, and inflammation is a major player among many others. I hope all the same to give you some general principles to keep in mind about medications that I and other psychiatrists prescribe. When a doctor prescribes a medication for you, they give you information about that medication. That process is called informed consent. And I'd like to illustrate how this process may result in your being reluctant to take medication. I'm going to do this by giving you informed consent before you eat 2 scoops of black walnut ice cream. Informed consent would say, ice cream can lead to weight gain, which can lead to multiple chronic illnesses that can shorten your life. If you have a hidden nut allergy, you may have a systemic allergic reaction to the nuts in the ice cream and die. It's possible, due to the melting quality of the ice cream, that you may incur laundry bills from it dripping on your clothes. You may find yourself thirsty for water after you eat it and there's no water around. You may find yourself having an ice cream headache if you eat it too fast. Eating 2 scoops of ice cream, if you're diabetic, could raise your blood sugar excessively. You may find yourself sleepy after you eat the ice cream and be less able to concentrate. If you're trying to eat the ice cream while driving, you might be more likely to have an accident. Having ice cream may result in feelings of guilt that others cannot afford it, that you should not be eating it, and that you have spent your money foolishly. As you eat the ice cream, you may experience anxiety that there will only be so much of it. You may find yourself feeling upset that you did not get the flavor your friend ordered. Oh, and the ice cream might be delicious. That's how doctors explain medications. They tell you all the common side effects, the major but rare side effects, the problems with starting and stopping it. They don't really dwell on what it can do for you if you give it time to work. They don't tell you about the improvement in your life and function that you will be missing out on if you don't take the medication. They don't remind you that you might be getting sicker. And with depression, it could be lethal. Other things can cause you to be reluctant to take medications. Having a friend who has had a bad experience, seeing angry comments on the internet, or having parents who feel you should try harder and believe more in yourself rather than take medication can all be factors. It's easy to listen to anecdotal evidence rather than the results of medical research that provides a medication or proves a medication is safe and effective. Sometimes you have to argue with that part of yourself and those parts of our culture that feel somehow that you are a failure if you take medication. You may feel like taking medication is admitting to the world that there is something wrong with you. If your doctor prescribes medication, they think there is something wrong with you. That something wrong is a biological illness, not a moral failing or weakness of your character. And that's a good thing, because medicines don't help moral failings or character weaknesses. Instead, medicines address the altered body physiology. It's impossible for me to talk here about all the possible things you want to know about the medication or medications I may prescribe for you. In our session, I will give you my usual informed consent about the medication I'm prescribing for you. I want to use this video to talk about some of the more frequent things that come up with taking medications that I prescribe. I want to explain how finding the right medication and the right dose can be a complex process. Dosing has to be individualized, and no one knows going into it just what the ideal dose might be for you. The idea is to get the drug at a concentration in your blood that makes it effective without it getting too high and possibly causing side effects. Multiple factors affect blood levels. Imagine getting just the right amount of sugar in your tea to make it just the right amount of sweetness. If you have a large amount of water, you need more sugar. If you have a large amount of total body water in your body, then the medication gets diluted and you need a higher dose. If something affects that total body water, like sweating or getting dehydrated, then the level of medication goes up. If your drug is carried around on a carrier protein and another drug is carried around on that same protein and competes for the carrier, you'll need a higher dose. Some of it will get bumped off. If you have a drug that latches on to fat cells, and if you are like me and you have a lot of them to latch onto, then you'll need a higher dose. If you're young and have a very fast liver that metabolizes things out fast, it may take more medication because the body is getting rid of the medicine as fast as you take it practically. There are several pathways in the liver that metabolize medication, and you may be slow on some and fast on others. If you happen to be slow on a particular path that is the same as the path that's metabolizing your drug, then you'll need less drug to get the same blood level. Women and men metabolize medications differently. Other drugs may interact with your drug by affecting those liver pathways. Things you eat, like grapefruit juice in large quantities, can affect how some drugs are absorbed. The acidity of your stomach acid can affect how medications are absorbed. Because it's so complicated, it's important to be monitored as you take the medicine. This means you need to report both side effects and positive effects to your doctor. Then they will adjust the dose accordingly. There are no medications without at least some side effects. With the exception of sweatiness, lighter sleep, and taking longer to have an orgasm, by the time a month has passed, most people don't notice they still have side effects from taking the newer antidepressants. You'll find on the GCSU website, under the section called Resources and Required Assignments for Dr. Duffy, links to websites that deal with side effects of different medications. You'll also find there a handout that uses the drug Zoloft to illustrate the selective serotonin reuptake inhibitors, that is the SSRIs, as a group. In that handout, you'll see my efforts to explain the potential risk to the developing fetus when the mother is taking Zoloft. I want to underscore the need for you to use effective contraception if you're sexually active and taking medications, and this handout goes into more detail. Please read it, even if you're not taking Zoloft, to understand about contraception. You'll also find on the section of the GCSU website a link to several websites that give informed consent about medications. I mention these because it's easy to forget what I've told you in the session because you have so many things to think about. The process of informed consent is an ongoing one, and you should feel free to ask me questions about your medications the entire time you're taking them. I want to talk some about compliance and missing doses. The shorter the half-life of a drug, the more likely it is to cause you a problem if you stop taking it. It gets out of your blood too fast. So if you miss a couple of doses, you may find yourself having discontinuation symptoms. Just like if you suddenly stop taking blood pressure medicines, your blood pressure would go up as a rebound. Here are the discontinuation symptoms from missing or suddenly stopping altogether SSRIs and SNRIs. You may feel fatigued, anxious, agitated, irritable, nauseated, lightheaded, dizzy, have tingly sensations that seem to occur when your feet pound the floor and jar you, tearfulness for no reason, waves of sadness, and some rebound depression. With the exception of the depression, these side effects are irritating but not dangerous. You may find when the blood level goes up or down too quickly that you have some enhanced ringing in your ears. The symptoms can be minimized or prevented by gradually reducing the medication over a longer time when you're ready to stop the medication. If you've missed a dose or two, the symptoms go away after you take a couple of doses. These symptoms are called a discontinuation syndrome rather than withdrawal because your body has never developed a tolerance to the antidepressant. Tolerance is when it takes more and more of the same drug to do the same thing. When you take drugs that raise serotonin, like the SSRIs and the SNRIs, you may go through phases as the serotonin level rises. I try to go up slowly to minimize side effects, and the first week you may not feel like you're on anything at all. The second week, you may feel irritable and blah for about 4 days due to a transient drop in one of the neurotransmitters. It'll pass. You will go through a yawny phase where you yawn even when you're not sleepy. You'll notice if you get dehydrated that you get dizzy more easily, especially when you get up fast from the bed. Take your time getting up and drink extra water. You'll find you go through a tired, draggy phase that feels kind of like you took an antihistamine. That goes away. Then you go through a period of peacefulness and contentment that can feel almost floaty. Things don't get under your skin. Do your homework anyway. Then, around a month, you find you're feeling better, but you don't seem to have a sensation that you're on something. Sometimes it takes longer, and sometimes it takes a second medication to pull you out of it, like lithium, Abilify, thyroid, or Wellbutrin. Sometimes, after being on a medication for a while, it may not work as well as you experience, and you experience some subtle emotional numbing that can be addressed by augmentation or switching medications. Students who have inherited differences in how they metabolize drugs may do much better on one drug than another. Some rare students have genetic profiles that put them at risk for having suicidal thoughts on SSRIs, and so it's important to monitor response closely, even though it does not happen very often. In that case, the medication will be stopped, and medication that uses another mechanism of action will be considered. The GeneSight psychotropic test looks at how genetic makeup may affect your response and which drugs may be less likely to work for you or have more side effects. Their website is genesight.com. You can get an idea of how much such test might cost you. I can order them to send you a test kit to your home so you can swab the inside of your mouth and mail it back. It generally takes 10 days. They will also test to see if you have difficulty in methylating folate, and it takes longer as a consequence to get out the fight-flight chemical, and you stay anxious when you're triggered by stress, anxious longer than other people do. Part of evaluating you for medication will involve looking at physical illnesses that could account for your symptoms. This may require lab work or seeing your family doctor. In addition, there are non-medication alternatives that may help some that might be enough if you are not too symptomatic and you're willing to do the effort. The risk of trying these is that you might get worse while you're waiting for them to work. You would need to be monitored by a doctor either way. Thank you very much. That's the end of this particular video.